Mosquitoes are more dangerous than tigers. Very small, but can kill many people. Let's learn about the Aedes mosquito, which spreads disease. Aedes mosquitoes spread dengue, chikungunya, and Zika. Dengue is an most epidemic vector-borne disease in Thailand. In Thailand, there are many types of Aedes mosquitoes, but only two types has been reported as dengue vectors, Aedes aegypti and Aedes albopictus. Only female mosquitoes bite people and spread the virus. Both male and female mosquitoes usually feed on nectar. Only female mosquitoes need blood to get protein for laying eggs. Female Aedes mosquitoes usually bite during the daytime, so we're at higher risk of getting dengue during the daytime. Aedes mosquitoes lay their eggs on the inner walls of water containers. The eggs have a sticky coating, so they can stick to the surface. They are usually found just above the water level, along the container's edge. Even if the water is used up or dries out, the eggs can still survive. They can live for months or even up to a year, depending on the environment. When the eggs get water again, they hatch into larvae. When mosquito eggs hatch into larvae, they molt in 4 stages and grow 7 days. If we control breeding sites, we can reduce numerous mosquitoes. After the 4th stage, larvae turn into pupa. Pupa do not eat, so larvicide granule, Temophos, cannot control pupa. Finally, pupa become adult mosquitoes. Female mosquitoes that have mated can bite again after 2 to 3 days to get blood and lay more eggs. One mating can lead to about 3 rounds of egg laying. If the mosquito carries dengue, it can pass the virus to its eggs, transovarial transmission. Newly laid Aedes eggs are pale white. Within a few hours, they turn dark black. They're oval-shaped, like a grain of rice. The surface is not smooth and has a fine net-like pattern, which helps them stick well to container walls. Aedes larvae have a breathing tube at the tip of their tail, short, stout, and dark in color. They stay at the water surface to breathe, hanging down at almost a 90-degree angle. They swim quickly, wriggling like a snake or moving in an S shape. They are very sensitive and easily startled. Even a shadow or small vibration will make them quickly dive to the bottom of the container. They feed on tiny organisms and decaying organic matter in the water. Aedes mosquitoes like to rest in shading, hidden places inside the house. They often choose areas with dark colors or places that smell like worn clothes. Aedes mosquitoes prefer to lay eggs in clean, still water. They often breed in man-made containers, such as water jars, plant pot trays, vases, old tires, plant leaves, and any trash that holds water. Aedes mosquitoes usually lay their eggs in containers placed no more than 1 to 2 meters above the ground. So we should control mosquito populations to prevention and stop outbreak situations. There are many control mosquitoes methods, such as using chemicals to kill adult mosquitoes and larvae, mosquito bites prevention, using other living organisms for control, removing breeding sites, and improving the environment. If some dengue patient, it is important to prevent mosquito bites, both for the patient and family members, to reduce the spread of the disease. When using chemicals to control mosquitoes or larvae, always follow the label instructions. For example, larvicide granule, Temophos, with 1% active ingredient, should be used at a ratio of 1 gram per 10 liters of water. Larvicide granule, Temophos, is safe for people when used as directed on the label. It would only be harmful if a very large amount is swallowed, almost equal to a person's body weight. After controlling mosquito larvae, it is essential to conduct an assessment to evaluate the risk of dengue transmission in the community and to encourage continuous community participation in eliminating Aedes mosquito breeding sites. Now that we know about Aedes mosquitoes, the carriers of dengue, don't forget to control breeding sites and protect yourself to stay safe from dengue.